It's a struggle in the urban areas. It's an even bigger struggle out in the suburbs and beyond for hospitals to try to stay afloat. Joining us this morning is a healthcare specialist. And if you ever check out Bed Beacon, it's a platform and efficiency tool designed to streamline the system through cost reduction and transparency. We welcome Dr. Katie Jarvis to the program.
Thank you for having me.
Thank you, Dr. Jarvis. Thank you for joining us here in Memphis. And as I mentioned, I know it's tough in the cities, but also in the rural areas. And why is it difficult right now during this coronavirus crisis for areas outside the city?
Absolutely. So in the rural areas, in any area, really, if you don't have COVID or COVID symptoms, you just don't want to go to the hospital. And the rural areas aren't being as hard hit as far as the number of cases of coronavirus. So what happens is they just don't have people going to the hospital. So rural hospitals are really struggling because they've stopped elective surgeries. They don't have people coming into the hospital as much. And that means that a lot of rural hospitals are furloughing their staff. A rural hospital is already at risk of closure. In fact, Tennessee is the second highest number of cases as far as hospitals that have just shut down.
Wow!
In the rural areas.
Where's worse? Is it somewhere out like in big country up north, or is it another southern hospital or a southern state?
So it's Texas.
Okay.
And I'm sitting here in Texas, so I can feel the pain too. What happens is our rural town hospitals really have less cash on hand than a big city hospital. They only have a couple of months of cash. And, we've been going through this crisis with coronavirus for a while now. They also employ a lot of the local market. So when a rural hospital shuts down, they were the major employer for their town.
Ooh.
It turns out that if you don't have access to care in your small town, then your ambulance has to drive farther when you have a stroke to go into the big city, which means that you don't get care as fast. And we know that timing of care for a lot of really urgent or emergent conditions impacts how well you do.
And Dr. Katie Jarvis joining us on Memphis Morning News. And even before this, rural hospitals were, generally speaking, struggling anyway, weren't they?
They really were. So Tennessee has had about 13 hospital closures in the last decade in rural towns. So the Tennessee Hospital Association worked with the American Hospital Association's task force to look at ways that they can strengthen their rural hospitals, and have come up with a global budget payment that includes things like transportation and primary care and preventive care, home care in their payment. So they're looking at the patient comprehensively to try to support those smaller town hospitals.
And, for the hospitals to stay afloat, I would assume they've got to super streamline down and perhaps, I guess, get some outside help as well. What's the solution? Because obviously if you're living in a rural area, now you bring up a great point about a stroke, but there may be other things where infections, dealing with not just coronavirus, but maybe infections from other kinds of wounds and, gunshots and other kinds of trauma. What's the solution for them?
Well, I think that we've seen that the states that had Medicaid expansion seem to have fewer closures of hospitals. Mm-hmm. So I think that across the country, we're reconsidering, for the states that haven't adopted Medicaid expansion, that we're considering that.
Okay.
I know that Tennessee is one of the states that did not adopt Medicaid expansion, and Texas is one of them as well. So I think that our two states that have the most hospital closures are reconsidering that. I also think that there's an innovation center with Medicare that is looking at a few different models across the country. And it'll be interesting to see what comes from their models as far as what helps. We've heard a lot about stimulus packages lately, right, with coronavirus. And so rural hospitals actually received $225 million in one of those stimulus packages, which should help.
Okay.
Medicare is actually tacking on an extra 20% for the payment of patients who have coronavirus. And then because rural hospitals only have a couple of months worth of cash in their pockets to help with paying their employees in the setting of, not having as many patients come in, Medicare has also said, you know what, we'll just pay you for the next 6 months of care, and then we'll settle the bill later. So That's helpful too. I thought that was probably the most creative strategy they had was, you know what, we're going to pay for this either way, now or later. Let's pay for it now so that they have the cash on hand to handle the crisis.
Yeah, that's a good point. Dr. Katie Jarvis joining us on Memphis Morning News. Before you go, Dr. Jarvis, we're on the cusp in most of the state to slowly reopening here, with a few exceptions. Here we are. I think our lockdown goes on a few extra days beyond the state's order. From where you're at, what's happening in Texas?
So I think that our governor announces later today what he's planning to do. We have started some elective surgeries here, so I think that's helpful. I think that we have delivery of some kind of restaurants are able to deliver on the sidewalk, in some places. So, but hair salons and general businesses are limited.
Okay. All right. Dr. Katie Jarvis, thank you so much for joining us on Memphis Morning News. And please don't be a stranger. We'd love to have you back on sometime soon. But in the meantime, stay safe and have a great rest of your week.
Thank you. You too.